ولقد يسرنا القرآن للذكر فهل من مدكر.
Bismillahirrahmanirrahim. Conversion of amino acids to specialized product. It is the second section of the production of catecholamines from the tyrosine. We have gone through these slides. First of all, catecholamines. These are the following steps. Number one, phenylalanine first convert to tyrosine. Then tyrosine convert into the DOPA, then conversion of DOPA into dopamine, then conversion of dopamine to norepinephrine, and the conversion of norepinephrine to epinephrine. कुछ बुक्स में हमारे पास पाथवे टायरोसिन से स्टार्ट हो रही है और कुछ बुक्स में हमारे पास पाथवे फिनाइलएलेनिन से स्टार्ट हो रही है. इन बोथ कंडीशन हमारे पास दोनों चीजें ठीक है. If we start the pathway from tyrosine initially, to enter the tyrosine pathway, phenylalanine is first converted into tyrosine by the enzyme phenylalanine hydroxylase, which has a tetrahydrobiopterin as a cofactor. If this enzyme is deficient or a cofactor is deficient, then phenylalanine will be accumulated in the body tissue and then there will be less production of the tyrosine. This is the summary of the reaction. You can see that this is the structure of phenyl. This is a phenyl group and this is the alanine group. A side amino chain CH2CH and NH2COH. Here, hydroxylation is carried out in the presence of enzyme phenylalanine hydroxylase, which is a monoxidase, and the cofactor is the tetrahydrobiopterin. It utilizes NADPH and it get converted into NADP by transferring two hydrogen ion to the dihydrobiopterin and it will convert it into tetrahydrobiopterin. Finally, you will see that there is an addition of OH group in this. So, phenylalanine is converted into tyrosine by the hydroxylation of the fourth carbon of the benzene ring and the enzyme is phenylalanine hydroxylase. So, we can say that tyrosine is a 4-hydroxyphenylalanine. Then, the remaining pathway of catecholamine is discussed. We have certain adrenergic receptors. What are adrenergic receptors? These are the receptors on which the catecholamines are binded and after that they will produce certain effects. There are two major types of adrenergic receptors like alpha receptors and beta receptors. These two classes are further subdivided into alpha 1, alpha 2 and beta 1 and beta 2 and beta 3. All these receptors are basically G protein coupled receptors. डिफरेंट टाइप की हमारे पास जी प्रोटीन कपल रिसेप्टर्स हैं जो कि हम फार्माकोलॉजी में स्टडी करेंगे. दिस इज अ समरी ऑफ adrenergic receptors. Alpha 1 is mostly present in the blood vessels and it will, when a ligand bind to alpha 1 receptor, it will lead to vasoconstriction, increased peripheral resistance, there will be increased blood pressure, there will be mydriasis, there will be the closure of the bladder sphincters. Then we have alpha 2 receptors. Here these receptors are basically inhibitory in nature. They will inhibit all types of neuronal conversion through the CNS. These are present in the CNS. For example, they inhibit the norepinephrine release, auto-regulation of the norepinephrine secretion after the production of action potential. Then it also inhibits the acetylcholine release and it also inhibits the insulin release. As far as selectivity is concerned, in alpha 1, the affinity of norepinephrine is greater than the epinephrine, while on alpha 2, the affinity of the epinephrine is greater than the norepinephrine. Then we have beta receptors. Beta 1 receptors are mainly responsible for the increment in the heart rate. There will be more lipolysis. There will be increased myocardial contractility. There will be increased renin release. And these receptors are present in the heart. Beta 2 receptors are mostly present in the lung or in blood vessels. They will cause the vasodilation. They will decrease the peripheral resistance. There will be bronchodilation. There will be glycogenolysis in muscle and liver. There will be increased glucagon release. These beta 2 receptor after activation from their ligand. As far as selectivity is concerned, beta 1 receptors have equal affinity for epinephrine and norepinephrine, while beta 2 epinephrine is more bind to the beta 2 receptor as compared to norepinephrine. These are the locations of the adrenergic receptors where they are located. For example, alpha 1 are present in arterioles, coronary arteries, in visceral layer, cutaneous layer, in veins, in internal sphincters, in iris dilator muscles. Alpha 2 receptors, they are present in presynaptic membranes, pancreas, veins, adipose tissue, GI, sphincters, and salivary glands. Beta 1 receptors are present on heart, SA node, atrial muscle, AV node, ventricles, in kidney, juxtaglomerular apparatus, and adipose tissue. While beta 2 receptors are present in the arterioles, in veins, bronchi, in liver, in pancreas, in uterus, in iris, constrictor muscles. Beta 3 receptors are present in adipose tissue and urinary bladder. There are certain receptors agonist and antagonist. For example, alpha 1 agonist increases the blood pressure. Any drug which is similar to the or norepinephrine, they are mainly coupled with G protein receptors, and alpha 1 receptors are mainly GQ. Alpha 2 receptors, they are also a G protein coupled receptor with a GI. For example, alpha 2 agonists are basically alpha receptor are inhibitory receptors, so clonidine decreases the blood pressure. Some biological functions are controlled by two counteracting alpha 2 receptor subtype. For example, 2A receptors decreases the sympathetic outflow and blood pressure, where alpha 2B subtype increases the blood pressure. Similarly, other functions are regulated by the synergism at alpha 2 receptor subtypes. What is the difference between the alpha receptor and beta receptors? Adrenoreceptors mediate smooth muscle contraction and vasoconstriction, while beta receptors mediate vasodilation, and they call them the smooth muscle relaxation, bronchodilation, and the excitatory cardiac function. This is the structure of alpha receptors, and here you can see that when a ligand bind to its protein, which is a G protein, couple receptor are serpentine protein 7 transmembranous protein having 3 units alpha, beta, gamma, and when a G protein is when a ligand is attached to this receptor, this complex is removed, and beta and gamma subunit will be behave as a shuttle. Here, a enzyme alpha S receptor will be there, alpha I receptor will be there, and alpha Q receptor will be there. Stimulating receptors will stimulate the synthesis in the enzyme adenylyl cyclase. That after this will increase the production of cyclic AMP, while alpha I inhibit the adenylyl cyclase and they will decrease the production of cyclic AMP and the downward cascade. Alpha Q receptors are basically phospholipase C receptors, and here they will be responsible for the production of diacylglycerol and IP3 inositol triphosphate. Then we have beta receptors, and beta receptors are of beta 1 receptors, beta 2 receptors, and beta 3 receptors. So beta 1 receptors present in the heart, they are responsible for the increased chronotropic, dromotropic, inotropic, lusotropic, and increased production of renin, and there will be the increased lipolysis. They are mainly present in heart, and they will be the GS type receptors. Then B2 receptors, they are responsible for the vasodilation. They will decrease the peripheral vascular resistance, and there will be a slight effect. There will be bronchodilation, there will be glycogenolysis, there will be increased glucagon release, and there will be the lipolysis. These are the GS and GI type receptors. They are present in the lungs. Then beta 3 receptors, they are also serpentine receptors. They are causing the lipolysis in the adipose tissues. They are regulating the thermocycle, and thermogenesis will be there in skeletal muscle. There will be the relaxation of the bladder. They will decrease the inotropic effect. They will increase the vasodilation. They are also GS and GI type. These are the sympathetic nervous system innervation. You can see that there are several types of sympathetic ganglion are there, which are preganglionic neurons. Then we have a postganglionic neurons. This is the brain and this is the spinal cord. And here, if you talk about the preganglionic neurons, the neurotransmitter is acetylcholine, and after that these ganglia, postganglionic neuron is there. Depending upon the organ, a norepinephrine or there may be a epinephrine. Furthermore, there is an adrenal medulla where they are responsible for the secretion of further norepinephrine and epinephrine in the blood. These are certain effects of the activation of the receptors by the epinephrine and norepinephrine. For example, there will be the mydriasis in the eye, there will be decreased salivation, all secretions are decreases by sympathetic nervous system, there will be the bronchodilation mainly by epinephrine, there will be tachycardia, there will be slow digestive process like decreased digestion and decreased urination. These are the examples of the antagonist drug. Alpha receptor antagonists are some non-selective, some alpha 1 selective, and some alpha 2 selective. If we talk about the non-selective alpha receptor antagonists, we have phenoxybenzamine and pentolamine. Alpha 1 selective antagonists are prazosine, tazosine, doxazosine. These are the alpha 1 blockers. Then we have alpha 2 selective blocker. We have euhembin. Then we have the receptor antagonists. Again, they are non-selective, also called as first generation. These are nadolol, penbutalol, propanolol, timolol, etc. Then we have beta 1 selective, they are cardioselective. Asbutalol, atenolol, esmolol, metoprolol, bisoprolol. Then we have non-selective, which is also called as third generation, carvedilol, bucinadol, labetalol. They have certain intrinsic activity. Beta 1 selective, we have third generation, betoxalol, nabivolol. Beta 1 selective are mainly the antihypertensive drug, and while non-selective are the sympatolytics. Beta 2 agonist, if we talk about the agonist, then we have short acting drugs like terbutaline and salbutamol. The duration of action is about 3 to 4 hours, while we have a long acting beta 2 agonist like salmeterol and the formoterol. Thank you.